All right, good morning everybody. It's Dr. Pearlman. I'm back with another video. I'm going to cut straight to it. I had a patient that was in here today who's also a good friend of mine, trainer. She's fantastic. And she dealt with a lower back injury recently where she was doing a deadlift at the end of her workouts. A lot of us can relate to this at the end of the workout. And as she came up, one of the last repetitions, caught her back, had to stop her workout, and then we worked on the lower back for about a week and have had, about 85% resolution, we'll say. She's happy, I'm happy. But the thing was, today I was talking to her about the disc in the spine, the lower back lumbar disc, that L4, L5, L5S1 disc that could be hurt. And the term I use, because this is the term I use to describe disc injuries to the lower back, I say disc tears. And it kind of caught her by surprise. And so I was like, again, here I am. I may have done a bad job educating my patient. So I want to make this video, which is going to go straight to you. You know who you are. But in actuality, I'm going to just make it a public video so we can talk about back pain and understanding the disc's involvement in these disc injuries or the multifactorial approach of lower back injuries and how this works. So here we go. The disc in the spine is more than just a shock absorber. It is also a great generator, or should I say it's a great signal caller for pain. There are something called sinovertebral nerves in the back or packed all around really the disc, but the ones we know and the ones we feel are in the back. So what happens is when we go beyond anatomical integrity and flexion, even just a little bit when we hinge forward. So picture that this is our lower back and we're hinging forward. We're hinging forward. And so if a disc goes beyond anatomical integrity, even by the littlest bit, because we're all different, our range of motion is all different, we get these micro tears, right? It's a tss, and that action during a deadlift or a squat many times can go tss. If we're squatting, it's very common for a tss, because of something called intrathecal pressure. The pressure is engaged. At that point, we're doing something called the Valsalva maneuver where we're bearing down. It's going, whether it's a sumo deadlift, whether it's a back squat, whether it's the traditional deadlift, sometimes it could even happen doing a split lunge. Romanian deadlift's very common for this to happen. And a lot of people want to chalk it up to like bad form. But I'm here to tell you it's not necessarily about the bad form. Think of it as being fatigued. Tissue deformity that exists at the level of where the injury takes place and you're fatigued is going to micro tear the disc. Those are called annular fissures, which is enough to shut you down anyways based on the perception of those sinovertebral nerves, let alone every other nerve packed densely inside not just the spinal column, but the spinal nerve root itself going to every organ, muscle, and gland in your body, okay? Those sharp pains you feel here, sharp pains you feel here. There's sciatic pain down the butt. Those are all related to these injuries. And what you have is the tendons, right? Connecting muscle to muscle is those tendons. Muscle, the end, kind of less vascularized part of the muscle is called the tendon. Tendons can get strained. What is a strain? It is a stretched fiber or micro to macro torn fiber of a tendon. What is a sprain? It is a ligament that is either this big over a joint or a ligament that's this big going from bone to bone. ACL, MCL. The lateral ligaments, potentially not on the knee now, but the ankle. Same thing in the back. Ligamentum flavum. Those are thick, densely packed, interwoven ligaments in the back of the spinal column that can get micro tears. And those are sprains. And so when you get a back injury, that's really gnarly kind of back injury, it doesn't even matter if you fall this way, if you fall on your butt, if you do the weightlifting actions that I was just demonstrating. When that back locks you down like that, you are getting micro tear to macro tear, torn fibers of the disc. You're getting micro tear to macro tear, torn fibers of tendons, and you're getting micro to macro torn fibers of ligaments. You can either have one, you can have all three. You can have it by this much, you can have it by that much. When those injuries happen, not only do they take time to heal, but that's the deeper understanding of what's going on anatomically at those levels. And a gigantic percentage of the time, not all the time, but a gigantic percentage of the time, that's what I see with lots of lower back acute injuries that put people in like the worst kind of pain A lot of them come to see me when they're like that. That's fine. That's what I'm here for, to help people that need my help. Whether it's a headache, whether it's lower back pain, whether it's dizziness, vertigo, whether it is knee tendonitis, ankle tendonitis, Achilles tendonitis, whatever. I'm here to help people on all the spectrums of pain, on all the spectrums of any disorder. And I hope now you have a deeper understanding of what's going on anatomically, biomechanically in the disc, the spinal areas, the spinal nerve roots, the joints associated with all the tendons and ligaments, and what happens when these injuries take place. If you have any questions, feel free to reach out, everyone. Until next time, it's Dr. Pearlman.